Actually, I was mute. Sorry, guys. Again, I'm introducing myself. That my name is Rohit Pandey. I'm a CPC certified medical coder, and as you aware with that, what is our topic? The topic is we'll talk about medical coding things and department as well. So, as you see on your screen, that what is medical? What is emergency department? So an emergency department, also known as an accident and emergency department, A&E, emergency room, ER, emergency ward, or casualty department, is a medical treatment facility specializing in emergency medicine, the acute care of patients who present without prior appointment. As we know that if accident happens, so it is not you know no one can take appointment. It's not uh, appointed. It happens suddenly. Okay, and we must go to the hospital without their knowledge that we are coming, and that is called the appointment in lemon language, either by their own means or by an ambulance. Okay, by their own means, from their own transportation, or by an ambulance. The emergency department is usually found in hospital or other primary care center. So from this you can understand that what is emergency department. Those things where patient not taking any appointment because he met with an accident suddenly. Okay, he's going from a highway and suddenly met with an accident, or a car hit him, and some kind of hemorrhage take place, and suddenly few people take him to the hospital without knowing. Hospital don't know that this condition happen, and they suddenly reach to the hospital, and hospital took this patient to their department, and that department is called emergency department. Okay, and in every almost in every hospital, emergency department is there. Okay, so due to the unplanned nature of the patient attendance, okay, I already told you, the department must provide initial treatment for a broad spectrum of illness and injuries, some of which may be life threatening and require immediate attention. In some countries, emergency departments have become important entry point for those without other means of access to the medical care. So when a patient reach to emergency department, what is the work of the emergency department? Emergency department, emergency department doctor try to stabilize the condition of the patient, and then if they think that patient is in good condition, so they move that patient to observation, or in other department, or if a patient need any specialization, if he have a kidney problem, any other issues, and suddenly in emergency department they try to stabilize the condition, and they just move that patient to other department when that patient get stabilized. Okay, his or her condition get stable. Okay, then they move that patient to another one, because as we know that in emergency department sometimes there are few patient, and sometimes there are a lot of patient. Just take an example: if a bus crash, or number of train crashed, or an accident happened with the train or bus, there are a lot of people, there are a lot of passenger in that bus or train. They suddenly met with an accident, and they all are in serious condition, or near the department or the government, what they do, they just put those patient in ambulance, and they went to nearby the hospital. And everyone, every hospital, almost every hospital have emergency department which is working for 24 hours. Okay, So they just go over there. So sometime emergency, in emergency department, there will be no patient, I mean low patient number, or sometime if some kind of such conditions happen, so suddenly there are a lot of patients. So they, what they try to do, they just give few time to every patient, okay, and they try to stable those patient, and then move those patient to another department. Okay, so the main work of the emergency department is like that. Okay, the emergency department of most hospital operate 24 hour a day. Why 24 hour a day? Because any accident, any trauma, anything happen, they I mean it not happen in between few hours. Okay, I mean it happens anytime. Okay, any I mean there are a lot of humans. Okay, they just met with any problem, like suddenly got a stroke, okay, any heart problem, any heart issues, anything happens suddenly to them. I mean accident or something, I mean it's related to suddenly got CKD or acute kidney failure. Okay, such kind of things happen suddenly, like acute care of the patients. So suddenly something happened. Okay, it may be natural or it may be because of trauma, and anything, anyway. Okay, in any way, if a person came in a I mean that life threatening condition, so emergency department must be open for 24-hour day, although staffing level may be varied in an attempt to reflect the patient volume according to, I mean if there are a lot of patients, then different department guys came to the emergency department to handle out that critical situation. Okay, I hope you understand what is the emergency department. Now, you see that how emergency department situation looks like. Okay, so now we came to what the difference between inpatient and outpatient care. So inpatient and outcare patient, what is the difference? Okay, so now the difference between an inpatient and outpatient care is how long a patient must remain in facility where they have procedure done. Okay, so main difference between the inpatient and outpatient, it is all related to how long patient must be remain in the facility. Okay, he present in the facility where they have the procedure done. So firstly, inpatient care. So inpatient care require overnight hospitalization. Okay, patient must stay. So it is an important point. Inpatient requires overnight hospitalization. I think it must be 24 hour or more than 24 hour. Okay, patient must stay at the medical facility where their procedure was done, which is usually a hospital. Okay, for at least one day, one night. Okay, patient must stay the medical facility where their procedure was done, which is usually a hospital, for at least one night. Okay, during this time they remain under the supervision of a nurse or doctor. Okay, so during this time they remain under the supervision of a nurse or doctor, it doesn't matter. Okay, the thing is he must at least present at least one night. Okay, it means more than 24 hours, I hope. Okay, so now outpatient, patient receiving outpatient care don't need to spend a night in a hospital. So as you know, OPD, outpatient care, we usually go to the OPD, outpatient department, where if we felt any fever, anything which is, I mean not so critical, so we went to there, and certainly they just gave us medicine, they treat us, they ask our problem. Okay, and we same day we came to our house. Okay, so we don't need to spend time in night to the hospital. Okay, so patient receive outpatient care don't need to spend a night in a hospital, they are free to leave the doctor's office, outpatient clinic or hospital once the procedure is over. Okay, sometimes they need to wait while anesthesia wear off, or to make sure their are not any complication, as long as there are not any serious what is this complication, though patient don't have to spend the night being supervised. So inpatient and outpatient is it's totally all about the how much time patient present in a hospital. That's the important thing between the inpatient care and outpatient care. Now you understand in a way. Okay, let's go. Mm. Okay, what is the difference between the facility and professional coding? So, as you all know that what medical coder is doing, okay, what we are doing, okay, I already tell this to different video on with different videos. So now we are going to, do that. What is the difference between the ED facility and ED professional coding? And such kind of questions are raised by interviewer to interview view. Okay, in interview. Okay, so you have to know that what is the difference between ED facility and professional coding, ED professional coding. Okay, so for your knowledge, I'm doing the ED professional coding. Okay, so facility coding reflects the volume and intensity of resources utilizing by the facility. Okay, so facility coding is like the volume and intensity of resources like gloves and all this and that utilized by the facility to provide patient care. Okay, whereas professional coders are like codings are determined based on the complexity and intensity of provider performed work and include the cognitive effort expended by the provider. So professional coding is all about the what provider is doing, but in facility coding, what resources and what is the what work did by provider. Okay, provider is like our professional doctor. Okay, here provider is like a professional doctor. So as you know that facility coding reflects the volume and intensity of resources utilized by facility to provide patient care. Okay, whereas professional codes are determined based on the complexity and intensity of provider performed work and including the cognitive effort expended by the provider. Remember that professional services represent the knowledge and skill of the practitioner, whereas facility service represent the resources consumed. Okay, so now you understand it in a better way. So let's go ENM components. I already completed this I knew this video to in the different I complete that topic in different videos as well. So ENM component, key components: history, examination, medical decision making, contributory factors, counseling, coordination of care, nature of presenting problem and time. Key components: history, physical examination, and MDM. Before 2021, before 2021, we usually, for level of service, there are three things are mandatory. They are compulsory. You call it like they are compulsory, like history part, physical examination, and MDM. But now these days, we totally depend on level MDM for the level of service. Okay, so previously in history, there is like HPI, history of presenting illness, review of system ROS, and past medical history was there. Okay, and we calculate history with these three, and their physical examination and medical decision making, MDM. So previously, after before 2021, in outpatient, I'm talking about outpatient, but after 2023, 1 Jan 2023, everything is changed. It's totally like what we were doing in outpatient. we totally depend for MDM on MDM for level of service. Okay, and now after 2023, 1 Jan 2023, we are depend on MDM for physical, I mean, inpatient, outpatient, emergency department, everything. But in emergency department, we there is no time foundation. I mean, no time things. Okay, but in out inpatient, outpatient, we just calculate our I mean level of service with the help of time also, and as well as MDM also. Okay, but in emergency department, we only rely on MDM part, because there is no any criteria for timing thing in emergency department. Okay, so just to relax for 5 minutes. It's like don't I don't have so much time, so just I'm continuing it. You can take time. Okay, so before you know about the emergency department, you all must know who is a medical coder, what important role he play, what is RCM procedure, and how it works. Okay, so, medical coder play an important role. Insurance companies can't read thousands of patient charts and these disease to pay money to the doctors. So here, the role of medical coder came. He just read the charts and put ICD and CPTs, and what he do? He just help doctors to get their payment. Okay, from the insurance companies. Okay, and some coders are on the insurance side also, and they are doing the same vice versa things, and they try to just save the money of the insurance company. And here we are working for the hospital or for the doctor or physician. What we try to do, just try to just give good ICD CPTs, and what are the procedures happen, we just give code of that also, and we try to make whatever money I mean whatever the money make by that chart, we just give our codes, and then we just get a reimbursement from the insurance company on the behalf of patient, whatever doctor, whatever doctor treatment I mean whatever the treatment doctor gives to the patient. Okay, so he will get money, and it's not bad. That's why we are getting our salary, because we are doing a good job for our doctors, and then they got the payment, and after that we will get our salary. Okay, so revenue cycle management, why we are doing such things, it's all is like RCM. uh, this world is existing because all around, I mean, the medical coder and billers, everyone, why they are doing that thing? Because of revenue cycle management, we totally we all are, I mean, patient, doctor, insurance, all are working. I mean, he need he need treatment, but for treatment he just paying some money. Okay, and doctor, if he treated the patient, he will definitely get the money. And insurance company, he just play with the not play, but just in layman language, he just make, I mean, it is a bridge between the patient and doctor. Okay, so here we are going to understand what the revenue cycle management. Okay, revenue is like money. Okay, and the cycle management is what where the money go. Okay, and we just manage it. Insurance company, if insurance company give money to the doctor, then he need claim. If doctor claim, then insurance company give money, but before that he need to know that is there any fraud happened or not. He just check out that seriously patient got that treatment or not. Okay, same with the patient. If patient give premium to the the insurance company, then insurance company will give the reimbursement to that patient, or if he claim, then insurance company just pay the money to the doctor. Okay, and what patient and doctor's relation, he just want the treatment, and if he don't have whatever the premium he paid to the insurance company, and those disease which are in on the insurance policy, so he will treat it accordingly by the doctor. And whatever the treatment doctor will give to that patient, he just give he insurance company give, he just give the insurance detail to the doctor, and insurance company reimburse or pay the payment to the doctor, whatever the treatment given by the doctor to the patient. Okay, so what is the medical coding? Medical coding is the transformation of healthcare diagnosis, procedure, medical services, and supplies into the universal uh, service medical alphanumeric code. So alphanumeric codes are like R51.9. Okay, it is for headache. R50.9, it is for fever. R05.9, it is for cough. And there are a lot of I51.7 cardiomegaly. Okay, R50.9 heart attack. And there are lots of codes which are alphanumeric. It is ICD code. As you, when you are going through all these books, then you will understand what we medical coders are really doing. We just go through the chart, we just read those charts in a proper way, and then we code accurately. And we will find codes from these books, and we have sites also. Encoder Pro is a good app where we can go and find out the ICD CPT codes easily. Okay, if we are aware with that Encoder Pro, so it will be easy for us to just find out the specific codes. Okay, so we can give that and there is no fraud happened. uh, I mean, we if we just put wrong codes, then it is like fraud we are doing with our doctors and insurance companies as well. So we have to read every chart in careful manner, and then just put out ICD or CPT codes. Okay, so we have CPT, current procedural terminology. It is all about the procedure thing happen in that organization. Okay, ICD 10CM, it is like international classification of disease. 10th revision, clinical modification. It's all about diseases. And at CS, healthcare common procedural coding system. In that we usually find out things shared, things used by the doctors, like ambulance, gloves, and all the instrument used by doctor. So it came to in that thing in at HCPCS. Okay, so I hope you all understand these um, things in a easy way. I tried to make these things in easy way. Okay, so I hope it's end of the video. If you like this video, and if you want another topic as well, so you can write in comments. I will definitely make videos on that also. And I hope you will like that thing. If you need if someone wants this kind of videos, you can share with them also. Okay, thank you so much.